Hello, my name is Dr. Philip Oob. I want to talk about female hormone replacement. Specifically, this video is going to be more for the menopausal woman or the perimenopausal woman that's approaching menopause. And I just want to talk about some of the concerns, some of the benefits, some of the risks, that kind of thing, and clear up the water because there's a lot of muddy water regarding hormone replacement. So first of all, my name is Dr. Philip Oob. I'm a functional medicine doctor. I do a lot of hormone replacement and I'm located in Austin, Texas. So for women who have gone through menopause, conventional medicine typically tells you that hormone replacement is bad and that your menopause symptoms of hot flashes and night sweats, they'll eventually just fade. Here, take some sertraline or some Zoloft until the symptoms fade, and the anxiety and stuff, that's just a sertraline deficiency, so you should take sertraline or Prozac or whatever, and you'll be fine in a few years, and you usually end up staying on that SSRI or antidepressant for the rest of your life, because they're so common right now. But I want to tell you that there's another version of hormone replacement that conventional medicine isn't really familiar with and isn't really putting a lot of emphasis on, mainly because they don't know about it. And that's called bioidentical hormone replacement. So to talk a little bit about the conventional medical side of things, back in the 1980s or so, there was a very large trial with hormone therapy called the Women's Health Initiative, the WHI trial, and it had 100,000 women, a ton of women in this trial. And basically they put these women on hormone therapy and we thought everything was going to be great. After all, menopause is a hormone deficiency, so of course replacing those hormones should make a difference. Well, it turns out that there was more cancer, more heart attacks, more strokes. It didn't get the bone building that we thought it was going to do, and basically just had a whole bunch of bad stuff and not any of the good stuff that we thought. And so the trial was ended early because it was looking so obvious that hormone therapy was dangerous. So if that's the case, then why am I talking to you about hormone therapy today? It's because there were major flaws in that trial. First of all, my biggest pet peeve is that you're never supposed to swallow hormones. Anytime you swallow hormones, that entire dose of the hormone goes from the stomach, 100% of it, goes from the stomach into the liver. Whenever the liver sees that much hormones all at once, it makes proteins and cofactors and things to try to break down that hormone. Or let me say that differently. When the hormones hit, the liver tries to break down those hormones and it makes proteins and byproducts as kind of a sequelae or a complication of digesting all those hormones so rapidly. Whenever your ovaries made hormones, it delivered the hormones all throughout the day, for 24 hours throughout the day, and it never put it straight into the stomach. It put it into the bloodstream, and the liver samples the bloodstream. But you may not know this, all the contents from the stomach and digestive tract go through the liver before it goes anywhere else throughout the body. So when you swallow hormones, it goes straight to the stomach, and 100% of it goes to the liver before it goes throughout the body. And we call that the first pass effect. When that happens, the liver makes inflammatory products. So anytime you're on oral birth control or hormone replacement that you're swallowing by mouth, that goes to the liver, and the liver makes CRP, which is an inflammatory product, and it also makes blood clotting factors. That's why your risk for blood clots is higher on birth control. Now, that's not the case for all birth controls. It's only the swallowed birth controls. Now, the warning is still in the label for all birth controls because Big Pharma doesn't want to get sued. I don't blame them for that. But realistically, the risk is only with swallowed hormones. Now, there is a caveat. The only hormone that's safe to swallow, from what it appears right now, is progesterone capsules, and those are the bioidentical progesterone capsules. Those seem to be safe to swallow. A lot of women take the progesterone capsules because it makes them sleepy. They take it at night and they get some good rest. But other than that, any other hormone is not safe to swallow. You cannot swallow testosterone and you cannot swallow estrogen, and you should not be swallowing any of the other synthetic hormones. So problem number one with the WHI trial is that they used swallowed hormones on everyone. Problem number two with the WHI trial is that pretty much during that time frame, if you were a female and you had a uterus, check, your uterus was removed. Commonly, hysterectomies were performed as soon as you went through menopause. It was considered a useless organ, so we just took it out, and because you might be having weird bleeding during perimenopause, so we just took the uterus out. And then basically when the WHI trial went on, if you didn't have a uterus, you were not given progesterone because we didn't think you needed progesterone. Why would you need progesterone? The progesterone's only used for the uterus. So we thought, Wrong. It turns out that the female has progesterone receptors even after menopause, so they do need progesterone. They also need estrogen and testosterone. You need all three hormones, just like men need all three hormones. You have receptors for all of them, and if you're going to replace any of them, you should be replacing all of them, or whichever ones are needed. Estrogen and progesterone kind of play a yin and a yang effect, so estrogen is somewhat stimulating, progesterone is somewhat deactivating, and so they're kind of balancing each other. That's why if you've seen any of my estrogen dominant videos, estrogen dominance comes with not so fun features, and that's because there's too much estrogen and not enough progesterone. But the same can happen in the flip side. If you take too much progesterone and not enough estrogen, you can actually have kind of fatigue and bloating and kind of deactivated too much progesterone. So both of those hormones are important. That's problem number 3, technically, with the WHI trial. The first one is they use synthetic or they swallowed hormones. Problem number 2 is if you didn't have a uterus, or I guess it was problem number 2. Problem number 2 is if you didn't have a uterus, they didn't give you progesterone, because if you didn't have a uterus, you didn't need progesterone. So all those women were on estrogens only without the protective balancing effects of progesterone. Problem number 3 is that they were using synthetic hormones. So the synthetic hormones are not the same as your own bioidentical hormones. They are either made in a lab and based on being chemically similar to your estrogens, or they were also using horse breakdown estrogen products, which are found in horse urine, and they were drying them out, crystallizing them, putting them into a tablet, and then women were swallowing those. The big problem with synthetic hormones is that they are synthetic and they don't use the same breakdown products as our own human body. So it's reasonable to assume that they might stimulate some cancer, might stimulate some inflammation. But what bothers me even more is that using horse estrogen breakdown products, we now know that your own estrogen breakdown products can be cancer causing. There's 3 ways to break down estrogen: 2, 4, and 16 hydroxyestrone. You didn't know that part, but what you need to know is that those 3 have very different characteristics. 16 kind of causes cancer, 4 definitely causes cancer, and 2 protects you from cancer. So if you had to choose which estrogen breakdown product you would make, which one would you make? You would make the 2. Well, when you're taking a horse's estrogen metabolites, I don't know anything about horse estrogen metabolites, but one can only assume that some percentage of those are going to be 16 and 4 or something similar that are cancer causing. On a side note, you can force your body to make 2-hydroxyestrone, the one that's cancer protective, breast cancer protective, and basically that's done by eating cruciferous vegetables. So broccoli, cauliflower, Brussels sprouts, cabbage, all those encourage your body to go to 2-hydroxyestrone. So is it really any wonder why eating a healthy diet actually encourages healthy living and lower cancer rates? And that's one of the reasons. It decreases the hormone metabolites that cause cancer. So those are the really big issues with the WHI trial that I have. There were more issues, but those are the big ones. And so now I'm going to talk a little bit about the alternative treatment. I use bioidentical hormone replacement, and I want to tell you how that's different than what they used in the WHI trial. So bioidentical hormones, that means that biology, your own systems, and identical means that it is the same exact hormones that your ovaries made when you were fertile and making hormones, the same ones men make. We don't farm humans for their hormones to give them to you, so they are made in a lab. They are technically synthesized, but they come from yams usually, and the yam hormone is converted into the bioidentical same estrogen, progesterone, testosterone that your ovaries made or are still making, and so your body doesn't know any different. So that's difference number 1 from the WHI trial, that you are doing bioidentical hormones, your body doesn't know any different, it's going to break them down the same way as it always does. Now, based on your diet, you can still make dangerous cancer-causing estrogens, so that's important to know. So anyone that's doing hormone replacement, I usually encourage them to take a DIM product, D-I-M, that's the active ingredient in broccoli. I3C is similar to DIM. And so eat broccoli or cruciferous vegetables, take I3C or DIM are your options to make sure your body's making the 2-hydroxyestrone. Apparently a bird just flew into the window or something. So, so that's the way to encourage your body to break down estrogen. The second thing that's different with bioidentical hormone therapy that was not found in the WHI trial was that I don't let you swallow your hormones. The 3 main options to get hormone therapy into your body is by rapidly dissolving tablets. That seems to be the most popular because it's really easy to do. The second version is creams. I'm not the biggest fan of creams, although I do use them. I have many women on them. The problem is that the skin is kind of a barrier that changes every day. The skin doesn't really want to absorb stuff, and so I find that I end up just chasing hormone levels a lot when I have women on cream. Sometimes the levels are high, sometimes the levels are low, so I just haven't had the greatest success with maintaining levels on those. They do work though, so if you're on them, please, and you like them, please continue them. My favorite method though is the bioidentical pellets. So the pellets are tiny little crystallized hormones that basically I make an incision in the back of the hip, in the buttocks area, and we implant a pellet underneath the skin, and this pellet slowly releases hormones throughout the day and throughout the months, and so it makes this really consistent level over weeks to months. Almost everyone gets 4 months of hormones out of their pellets, but most women I can get 6 months of hormones out of their pellets, and then the pellets dissolve. They aren't removed. We can't remove them. And by the end of when their hormones are starting to come down to the lower normal levels, they would just put in more pellets and the levels go back to the kind of high normal, and then they coast down to the low normal by the end of treatment, and then we put in more pellets and they go high normal, low normal, and it makes the most steady, consistent levels, the easiest to adjust, and of course we base the dose on your body type, your body weight, and then we check levels to find out how high your levels are going, and we adjust the dose, and that's how I do it with all the hormones. So with the WHI trial, you were given a standard dose that basically every woman took, and it was the same thing, no matter what your symptoms were, it was a standard dose. And so that's different because not everyone metabolizes hormones the same way. Many times when I put everyone, I kind of start everyone on the same concoction, and then after testing, I'm always manipulating each version. I'm moving up the estrogen, I'm moving down the progesterone, tweaking up the testosterone, all of it based on symptoms and on lab values. And so to think that every woman can get away with the same dose is just kind of nonsense. So that's the other thing. We're individualizing it for each person. I always start with kind of the same concoction based on each person, although I tweak it based on body weight a little bit. But you'd be amazed that I very rarely have 2 patients that are on the exact same concoction because of how they break down hormones or how quickly they digest or what their metabolism is like. So those are the big differences between hormone therapy. I will encourage you that if you are going through perimenopause, or you're worried that your periods are spacing out, or that you're having hot flashes, night sweats, your brain fog, anxiety. Anxiety is a big symptom that hits women in the menopausal area, and it's thought to be because as you're getting closer to menopause, the estrogen and progesterone levels start to imbalance, and the progesterone starts to fall first before the estrogen starts to fall. So you may still have periods because the estrogen is going up and down, but the progesterone is really getting more deficient. And like we talked about, progesterone is kind of a deactivator and an anti-anxiety hormone. So without the progesterone, the estrogen becomes anxiety provoking, and many women go through anxiety and excessive worry and kind of feel a little nuts and have crying spells and emotional outbursts, irritability. And so if any of that is happening, I'd encourage you to get with a bioidentical hormone provider that knows and understands labs, because someone may have told you that your hormones are normal, but remember that lab values are based on 90% of the population, and you may not want to be that 90% of the population, because there's some people that don't feel that well, but their labs are included in the normal population. So really get with a hormone expert that knows how to tweak the labs. And if you're postmenopausal, I'd encourage you to have a discussion with your doctor about the different options, but make sure they know about bioidentical hormones. There's a saying that if a doctor is not up on something, then they're most likely going to be down on it. So I would not encourage you to talk to a doctor or a physician that does not know about bioidentical hormones, because they're inevitably going to say no, or that's not real, or there's no different in it. I'd encourage you to ask someone that knows about it. And although I'm a big fan of hormone replacement, it's not for everyone, and there are risks. I'm going to briefly tell you the 2 mentalities between hormone replacement, and there's basically 2 main camps of people. One camp believes that menopause was designed by Mother Nature, and so after you go through Mother Nature, you should spend the rest of your life without those hormones, and that's just a fact of life. The other camp, the camp that I kind of belong to, but I never force any of my patients to do hormone therapy. I just tell them their options. And so the other camp, the one I belong to, is that your hormones burned out at menopause, but you really weren't designed to live to 100. We as cavemen, that's kind of the last time our DNA was expected to have evolved or changed enough to really make an impact. And back then, our average lifespan was like 32 to 35. So yes, menopause was planned, but you were also planned to be dead by menopause. So we're kind of in a different area. So yes, menopause is Mother Nature, but we're living so much further beyond that. And the estrogens and progesterones really make a big difference in the brain. And so if There are risks associated with hormone replacement, but if you feel better, and by feeling better, you're going to exercise more, and by feeling better, you're going to eat better, then you're already elongating your life because you're going to eat better and feel better. Another thing to consider is quality of life. If you feel better on hormone replacement, and you're worried about cancer risks, so you don't do hormone replacement, and yes, you may live longer but feel like crap during that live longer, is it worth it? So you really have to choose what's right for you and what you think, and especially based on family history and personal history, if you have any breast cancers, ovarian cancers, anything like that. So have a good discussion with your doctor. Look up bioidentical hormones. I've got more information on my website about the pellets, dissolving tablets, creams. Feel free to look it up and learn more. Do your research, guys. So feel free to leave any questions, comments about hormone replacement. I certainly do a lot of it in my practice, and I encourage you to come see me, get your hormones evaluated and tested, and let me see if I can help balance your hormones. Thanks, guys.